Hi class, it's Dr. Balderas. This video today is going to be talking about therapeutic ultrasound. You can read about this in chapter 9 of Cameron. I would highly recommend that prior to listening to my video and reading your chapter that you go to the glossary in the back of that chapter on page 194 and look at the definitions of the different words. The language for ultrasound is definitely a little bit unique. So it's kind of nice to familiarize yourself a few times with those words so that you can make a little bit more sense. The pictures here are the machines that we have in our lab, along with we have a new updated version of the Solaris that also has eSTEM with it. So we'll go over those in class and we'll find out which ones you like best. And just to remember that therapeutic ultrasound is different than diagnostic ultrasound. It's just a different sound wave. Diagnostic ultrasound is the one that you use when someone's pregnant to check everything out to make sure it's okay, or they do it diagnostically when they're looking for certain pathologies in people. Whereas therapeutic ultrasound is at a frequency that helps promote tissue healing for us. And so we'll talk a little bit more about why we use it in physical therapy. So here's basically it's a high frequency sound wave is how we describe it by its intensity, its frequency, its duty cycle, its ERA, or what we call its effective radiating area, and then the beam non-uniformity ratio, which is the BNR. And these two things you will find on a little sticker on the sound head somewhere. And all of these you will want to know what they are when you go to document so that somebody can replicate your treatment. We'll go over each one of these specifically so it'll make a little bit more sense to you. And when we get into lab on Monday, it'll definitely tie it in more. Sorry about that. It enters the body and is attenuated. Attenuated just means it goes into the body. And as it goes into the body, the energy dissipates. And that's based on the absorption. And basically about 50% of it is attenuated by absorption of the tissue that you're using. And there is some reflection and some refraction. And we'll talk about that a little bit more as we go further into the sound head and the piezoelectric effect. So the history of ultrasound, I think you can read about that in the beginning of the chapter. I think they discovered it originally around World War II when they were trying to do sonar with submarines. And then they realized that they could use it therapeutically. And so that's kind of where it started. It's a high frequency greater than 20,000 cycles per second, which is measured in hertz. And that's the abbreviation for hertz, which is nice for you to know for when you're going to go do documentation of things. The sound transmits energy by compressing it and rareifying those molecules, and that's what creates that energy. The therapeutic ultrasound frequency that we use in our machines is 0.7 to 3.3 megahertz. So that's important for you to know and to know how to document that. The maximum energy absorption to depth of 1 to 5 centimeters, and that's based on the intensity of the settings, the parameters that you do as to whether it goes more superficial versus deep. We talked about this a little bit with diathermy. It's very similar, except for the ultrasound does a much smaller area, and it definitely goes deeper than that superficial hot pack. And so there's different parameters of to why we would use ultrasound versus a hot pack on somebody. Again, like diathermy, you have a continuous mode, which is going to give you that thermal effect. And then you have the pulse mode, which is just going to give you that non-thermal or more mechanical therapeutic effect. So absorption coefficient of tissues, we kind of talked about this a little bit in our other thermotherapy lectures. The tissues with the highest collagen content that heat up most, and this is important for you to know so that you know what tissues you're working with and to make sure you're getting that blood flow into an area that needs some healing. So that's the bones, the cartilage, the tendon, the ligaments, and the fascia. Tissues with a higher water content have less of a heat effect. So they may get the mechanical effect, but they're not going to get that thermal effect that you're going to get up here. And that would be your muscle, your fat, and your skin. So thinking about absorption and sound head creating heat, you are going to be a little bit want to be a little bit careful about a bony area as far as not having it heat up too fast and causing what we call a periosteal burn. And this is just showing you the different layers of the tissue. So there's the muscle, and then there's the hypodermis with the adipose tissue, the vascularity of it coming into the skin from the dermis, and then the top layer, the epidermis, with a little bit of the superficial stratum on the top of there. So just to kind of remind you of how that works and the different layers. I'm going to stop right here, and we're going to start back up here, all right? Thanks.